Hello everyone, we are Francis Dijeh
And Elisa Vengelil.
and along with Dr. Christopher Inakmene, we are presenting a retrospective cohort study on the variations in the utilization of prenatal invasive diagnostic genetic testing in at-risk women in the era of cell-free DNA.
In 2007, the American College of Obstetricians and Gynecologists, also known as ACOG, recommended that prenatal genetic diagnostic tests be routinely offered to all pregnant women, regardless of age or risk. This is desirable as the presence of genetic disorders or birth defects in offspring can result in emotional distress to expecting parents and cause significant economic burden to them and to their society. Patients who choose to undergo diagnostic testing do so for a variety of reasons, but studies have shown that there are racial and ethnic differences in the number of patients who choose to undergo this testing. Whether these differences are impacted by non-invasive prenatal screening is less understood. This study aimed to assess demographic and clinical factors that influence patients' acceptance of prenatal invasive genetic testing in the era of non-invasive, cell-free DNA screening.
A retrospective cohort study was performed on women who had genetic counseling from January 2010 to August 2018 at the University of Illinois at Chicago. Cell-free DNA screening was introduced in UIC in November 2011. Patients' charts were reviewed and statistical analysis was performed using chi-square, Fisher exact test, student t-test, bivariate, and multiple logistic regression analysis.
Of the 2,371 women who had genetic counseling at UIC, 319 had invasive diagnostic testing during the study period. Amongst women at increased risk of fetal aneuploidy, Asian women accepted diagnostic invasive testing the most, at 27.7% of Asian patients, followed by white, then black, then Hispanic women, at 17.7%, 12.1%, and 11.7% respectively, with a p-value of 0.002. The higher the number of indications for genetic counseling, the more likely invasive diagnostic tests were accepted.
This table shows the demography of women who had genetic counseling at UIC from 2010 to 2016. We have taken note of the variables of ethnicity and race in the previous slide. This table shows the indications for genetic counseling and proportion of invasive testing. Examples of indications include cystic hygroma, which is associated with Turner syndrome, and increased nuchal translucency, which is associated with Down syndrome. With one indication, 11.5% of patients had invasive testing. Two indications was 17%, and three or more indications was 37.2%. The most common indication for diagnostic testing was cystic hygroma, with a relative risk of 7.5. Other statistically significant indications were abnormal serum analytes, increased nuchal translucency, two-vessel umbilical cord, echogenic bowel, thickened nuchal fold, and short bones, with relative risk of 1.3, 1.9, 2.7, 2.7, 2.8, 3.1, 3.3, and 4.0 respectively. Choroid plexus cyst, absent/hypoplastic nasal bone, echogenic intracardiac foci and pylextesis were not statistically significant reasons for accepting invasive testing.
The results from our study indicate that Hispanic and Black patients are less likely to undergo invasive diagnostic testing compared to Asian and white patients, which is consistent with prior clinical studies. For example, in 2004, Singer et al. Found evidence that Latinos and African Americans are more likely to express preferences for prenatal genetic testing than white patients. African Americans and Latinos were also found to be less knowledgeable about genetic testing than non-Hispanic whites, and were less likely to have the financial resources or insurance coverage that would facilitate access to testing. In 2012, Chen et al. Found in large communities of Chinese Americans in the southern U.S. that most patients were in favor of utilizing prenatal genetic testing. These racial and ethnic differences in the acceptance of prenatal diagnostic testing are also supported by Cooperman et al., who suggest that the reasoning behind this could also be from socioeconomic factors or lack of patient education. However, in our study, when it came to non-invasive testing, a higher percentage of Hispanics and Blacks were more accepting of the procedure compared to whites and Asians. This suggests that non-invasive pregnancy testing could be an avenue to increase the chances of genetic testing for pregnant patients of minority ethnic groups as compared to invasive testing.
In conclusion, screening tests can provide an opportunity to categorize the risk of having genetic disorders, but they may raise unnecessary anxiety with false positive results. Various factors can influence acceptance of invasive diagnostic testing. Therefore, this study can further enhance knowledge about the factors and lead to possible ways to break common cultural barriers, which can be helpful for more effective genetic counseling in the future. We wish to thank the investigative group at UIC who initiated this study.